Hey guys, this is Dr. John at Heritage Regenerative Medicine. I'm here with a really nice gentleman who was kind enough to let us film him doing some prolotherapy. We're doing prolo of the SI or sacroiliac joint and also a little bit lower. So the background story is this gentleman, he's a very active, muscular, very physical guy, but has a very physical job. And for the longest time, he's had pain kind of lower buttock into the origin of his hamstrings, and tried a lot of things. Tried therapy, he tried steroid shots, medication. Nothing seemed to work. As luck would have it, he found prolotherapy and found it to be helpful. So we've been treating for a while. It's gone from really, really bad to an annoyance and something, when you've got a physical job, sometimes it's something that you have to repeat, but it has worked quite well. The key really is knowing where to inject. A lot of people think pain down here comes from the back, and sometimes it does. But in this gentleman's case, it's local, because where I'm injecting is the end of your pelvis, but there is a really big ligament that goes down here called the sacrotuberous ligament, which goes to the origin of your hamstring. And as you might guess, he's got pain here and pain in the hamstring origin. So we kind of hit up here. You doing okay? Mm-hmm. Okay. I'm going to come right about, where's the worst spot? Am I kind of in there?
Down.
About there, worse? Okay. And I'm going to go further down, don't worry. So this is just a little anesthesia.
Up and down?
Right there, please, yeah. Just go up and down like right there. I'm going to do 2 spots right there. Thank you. Little anesthesia. Kind of keep, this helps you with the needle. A little alcohol wipe. And then basically a little injection to get past the skin. A little tissue compression. And you basically go down right there. And like I said, the patient's going to tell you. They'll let you know when it hurts. So the good news is when it hurts like that, that's exactly where you need to be. Right there. Good. Do one more. So people forget that this is think of this as a suspension belt. Tell me how you're doing. You okay? Okay, good. And will you hand me another syringe?
Mm-hmm.
We add a little more right there. These ligaments are suspension belts that basically hold you together. Ligaments and tendons. Let me give you that for one moment, since we got a needle in there already. We'll switch off. They don't have a good blood supply. They do not heal well, but they sure as heck have a lot of nerve endings, especially stretch receptors.
Switch it off?
Yes, please, yeah. Let's go to the new one. Thank you.
Mm-hmm.
So when they go bad, they're not going to be shy about complaining to you. And what does it lead to? Ligaments and tendons are what we call static stabilizers. They hold your body in place. Well, when the static stabilizers get damaged, your body only has one choice. It activates your dynamic stabilizers, which are your muscles. And so your poor muscles take up the load, which is why people who have chronic connective tissue problems, like ligaments, tendons, or joint cartilage, tend to get a lot of muscle pain and spasm and aching, because that's the only way your body can protect yourself. Let me know how you're doing, okay? You all right? Good. Am I there? Yep. This young man is very, very stoic and really good about it. So that's one side done. We're going to do the other side in a minute. We'll kind of get that area. We'll give him a couple weeks and see how he feels. If you guys have any questions, let us know. Shoot us a message at Heritage Regen, HERITAGE, REGEN.com. Thank you so much.